Welcome back. U.S. officials are now following reports of a new variant of COVID-19. Some pain medicines have been recalled. And could the grocery store be causing you cold sores? Got a lot to get to here. WL Louisiana medical correspondent Dr. Corey Hebert joining us to talk about these top health headlines. Good morning.
Good morning.
A new variant? All right, go ahead. Give it to us.
To this,
Are we back to this? Better not
There
be.
is a new COVID variant out there, and it is causing a little bit of a problem. But I want everybody to sit back in their seat, just relax, because while it is a bit more transmissible, it is not more deadly, okay? So we need you to always just remember that people are dying from COVID every day, right? We know that across this United States, every day people are still dying. Most of the time, these people are dying because they have pre-existing illnesses. But this new variant is the NB1.81, increased in China, but it's all over in Europe, Asia, North and South America. It is not more severe, okay? But like I said, it is more transmissible, and we expect to see a lot of these in the summer because most of us haven't had a COVID vaccine in a while, and there haven't really been any big surges in the last probably, we say 9 to 10 months. But the issue is that if you are an older person over the age of 65, if you're a younger person, then and you have a pre-existing illness, this is still very serious for you because people can die. Even though the CDC has basically said now with the vaccines that pregnant women and healthy children do not need to get the COVID vaccine at this time. There's not a lot of data to support that, but we have to always remember, talk to your doctor and look at your specific situation. And remember, keep your hands washed. I was at the airport just the other day, and I walked in, and when I walked out, nobody that was in there washed their hands when they left. And I was like, come on, man, really? Seriously, at this point?
That's like 101. Come on,
wash
guys,
your
wash
nasty
your
hands,
hands.
man. COVID or not,
all
wash
the
your
time.
nasty
Yeah.
hands, right?
Okay, so let's talk about some of the pain medications that are being recalled. What do
Okay,
people
so
need to know?
everybody in New Orleans knows that old dude Arthur that comes to get you. Arthritis, that's right. It comes to get you in the morning, okay, and it's a problem, all right? But what we have to recognize that there are medicines for this, but indomethacin, also known as Indocin, sometimes also taken for gout, all right, this medicine has been recalled. Not all of them, but some of the variants out there from a company called KVK Tech. It's a 100-count bottle. It's extended release capsule. And please, over 9,000 bottles have been recalled. And I need you to make sure that you get this taken care of if you do have the arthritis that people get in this beautiful city of ours. Now, some of the things that can actually cause arthritis, we know. However, I want you just to remember, if you have the gout, not gout, the gout, because that's how we say it here. All right, please be careful. Not a lot of red meat and not a lot of shellfish. But the last thing I want to talk about is cold sores, folks.
Wait, what are we talking about the grocery store and cold sores? How are they
see,
connected?
the thing about it is, when you see people coming back from vacation, a lot of times, especially in the summertime, they have fever blisters, cold sores. Almost 85% of them are caused by herpes simplex virus 1. That is not the same as herpes simplex virus 2. All right, so herpes simplex virus 2 is in the nether regions, and herpes simplex virus 1 generally is in the on the lip, right? This is a virus that lives in the trigeminal ganglion in the cheek, and then it gets activated. But what it gets activated by is sun, stress, alcohol, peanuts, and medicine, and foods that are high in arginine, okay? And you need to decrease the amount of arginine and increase the amount of lysine. So you can actually get supplements for lysine at GNC or whatever of the pharmacies you go to. You can get lysine. Take that. You can decrease the foods with arginine in them. Look them up. But the thing that really gets you, especially when you're on vacation, is that direct sunlight on the mouth and on the cheeks without sunscreen, eating a whole bunch of peanuts, drinking a whole bunch of alcohol, and just doing too much, folks. So please, if you do not want these cold sores, please make sure that you do the things that we discussed.
So don't be on vacation eating peanuts out in the sun.
Well, you know, I saw a dude one time in Destin. You know, he had a bottle, like a whole jar of peanuts, drinking a bottle of beer, and he had on his sunscreen. And man, if I didn't see him in the airport, you know, the little tiny airport they have there, he was all jacked up with that, you know. And I was like, I tried to tell him, but this is what you must do.
All right, some good advice there.
And you know what? Do you know if you have sickle cell trait? There's a study that just came out that said you have increased risk of acute heart failure if you have sickle cell trait. Not disease, but trait. Okay, that's 4 million people in America, black and white. I'll talk about it next week.
All right, thanks for that. If you missed parts of this talk or you want to see more of it back again, you can find the full conversation, WWLTV.com, and want to hang out with us next Tuesday. He's going to give us that update there. You can find all this information and top health headlines also on our website. All right, Peyton.